I will bless the Lord at all times, and his praises shall continually be in my mouth. Yes, this is Pastor Eve Rogers from New Dimensions Community Church, welcoming you as your host of Can We Talk? Positive, prophetic, and practical. I'm so excited about this privilege to bring together to you our Eastern North Carolina and beyond viewing audience, women who are active and who are movers and shakers in various arenas in our community and in our nation and world. Today, we have as our special guest on Can We Talk, a women's empowerment broadcast, Dr. Essie Torres, who is assistant professor in the Department of Health and Human Performance at East Carolina University here in Greenville, North Carolina.
Yes.
Joining Dr. Torres is Mrs. Carla Lee, and Carla is a breast health educator with the Pitt County Breast Wellness Initiative. And that's what we're going to talk about today. And this is particularly for all women, but also, and you can answer this later, but I think there are males or men who experience breast cancer.
Yes.
But of course, we know that the majority of patients that are afflicted with this disease all over the world, as a matter of fact, amen, are females. So that's where our focus is in this initiative. Welcome to Can We Talk? I appreciate
Thank
you
you.
joining me so that we can inform the community and activate their interest and their connectivity with the resources that you will bring to us.
Yes.
Dr. Torres, what is the Pitt County Breast Wellness Initiative?
It's an initiative funded by Susan G. Komen, Triangle to the Coast affiliate. It's a 1-year project, and we have 3 grants under the initiative. The first grant is my grant, which is an education-focused grant where we do breast health education and also help connect women to existing services. The second grant that's funded under the initiative is a screening grant, and that grant pays for mammography and follow-up diagnostic screening for women who are uninsured or underinsured in Pitt and Wilson counties.
Wow, that is so critical.
It is
we know
critical.
all over this country, the push and the need for affordable health care, and many, even with the Affordable Care Act, still do not have sufficient insurance coverage to cover the high cost of various tests and exams and imaging processes and this kind of thing. So this initiative that you are funded for 1 year?
Yes.
Okay, I'm going to jump to the end at the beginning. Is there any opportunity that this will be extended beyond this first year?
Yes. The second round of grants for us is due in December.
Okay.
And talking to all our, collaborators at ECU, we will all be putting in an application to get refunded. So this grant is from April through March. And so hopefully it will continue until 2017.
Okay. Wow.
And
now,
beyond.
Yeah, great. Exactly. We will pray toward that end. What area do you cover? I know it is called the Pitt County Breast Initiative, Wellness Initiative. Do you go outside of Pitt County?
Yes, the education component does Pitt and Edgecombe. And the screening grant does Pitt and Wilson. Because the reason they extended it to Wilson was because it was a very high demand of women that needed mammography screening that were uninsured. And then the third leg, I guess, of the initiative is a treatment grant that does not pay entirely for treatment, but it does pay a small proportion for treatment-related expenses like a prosthesis or a wig or other maybe a small portion of the chemotherapy or just some other kind of treatment-related expense that a woman might have.
Every bit helps.
It does.
This is a phenomenal charge and undertaking, by whoever the patient is.
Huge
even
financial
with,
burden.
Healthcare insurance, there are still those other things, those addendum needs that are there.
Exactly.
That many women need some continual help with.
Yes, and the treatment grant covers a large number of counties in East North Carolina because Leo Jenkins serves such a large number of counties.
Okay, say something about Leo Jenkins.
So
For
Leo
those who may not
Jenkins,
be familiar with that facility and program.
Leo Jenkins is our cancer center here in Pitt County, but it
Yes.
serves all of Eastern North Carolina.
Yes.
And Leo Jenkins Cancer Center is a joint venture between Biden and ECU.
Mm-hmm.
And so the grants are ECU, Brody School of Medicine, and Leo Jenkins, kind of all working together under this initiative.
Okay.
Mm-hmm.
In addition to those medical healthcare professionals, which
Yes.
you are, you also have a staff in this initiative of what you call breast health educators.
Yes.
Yeah.
So
Tell me what that position is, and then we're going to talk with Carla specifically.
okay, I would say it's probably the most important position
I
in my
can
grant,
imagine.
in
I
the
can
education grant, and really in the screening grant too. Our breast health educators help our women understand the importance of breast health, of breast screening. They help women access existing services, whether it's the screening grant or maybe the health department or the breast cancer and cervical cancer program that the health department has, the BSEP program. And they also offer comfort for women that might be scared to get screened, or women who are scared to get screened because they think they might have cancer. And in the screening grants, in the screening clinics that we have, so part of the screening grant is that we partner with Eastern Radiologist and also Carolina Breast Imaging Center, and we have these screenings once a month from 4 to 6 p.m. to accommodate women that cannot make it there during the normal business hours. And we offer interpretation, we help women fill out applications, we're there to talk to the women to kind of calm their nerves and just make it a very friendly environment. And so that, I mean, if you think about it, that's really the essence of this initiative.
Yes,
it's our breast health Yeah,
Absolutely.
it is, definitely.
Well, let me speak with Carla Lee, who is a breast wellness or educator. Tell me, how did you come to be a breast wellness educator?
I had worked with Dr. Torres before on a survey that we had done a few years back because I am a breast cancer survivor, a 5-year survivor.
Congratulations
Thank you.
praise
to God be the
God.
glory. Yes, indeed.
Yes.
And so Dr. Torres actually contacted me to ask me if I would be involved in this program as well. And I was very excited to be able to do that. And we went through a day-long training process. And because I understand the importance of being a support for other women and making sure that they, first of all, know they're normal and can detect that there's something wrong and know that there is some place that they can go for help.
Do you find, Carla, that sort of across the board with most women, you said that you want to make sure that they know they're normal. Are you still somewhat surprised at how many women do not, and thus the need to educate them to begin with them from point one and move them forward?
Definitely. It's surprising to find women who still are afraid to touch themselves, basically, to look at their
self-examination.
Bodies. Yes. And that's the only way to know if there is something abnormal. And then once you detect that, if you can, and then you take it to a professional, of course, and have them do further exams.
Yes. What have you found in your experience, in your work with the initiative thus far, that many women are most concerned about? Is it, okay, if I do have this disease, this cancer, are they concerned mostly about the cost for following through with treatment? Are they most concerned about and afraid of, the severity of the condition? And what do you do to sort of move them past those potential obstacles or hindrances, maybe in their minds because of lack of education and understanding?
Right. Well, I mean, the first thing is you do have to understand, to know.
Yes.
They want to know what to expect if it's cancerous. So, again, I'm there to try to ease that comfort and say, you know, what you don't know sometimes may hurt you. So you got to at least know.
No.
And
Yes.
talk with the professional
Yes.
to understand what's going on in your
Yes.
body.
Yes.
And to know that there are treatments. I mean, you know, cancer doesn't kill everybody. It doesn't have to.
That's right.
If it's found early in particular.
Wow, wow. Say that again, because I think so many of the women who are viewing this program need to be reassured in that. Sometimes when we hear, as we term it sometimes, Dr. Torres, the C word,
Yes.
you know, we automatically start making, you know, funeral arrangements. Not so, not so. And so what is your initiative and your overall goal and approach, perhaps, in this initiative to get women to become more comfortable with the fact that there is help and it's available to you and you and you? It doesn't matter where you come from, you know, your ethnicity, your racial background. It doesn't matter what side of the track you were born on, whatever that means.
Yeah.
But how do you go about, you and your health educators like Carla, to just continually encourage and equip women with knowledge and motivation to, we're going after this thing and we're going to fight it?
I think there is still a stigma in our communities about cancer, and breast cancer in particular. A lot of women think, oh my God, you know, if I have breast cancer, what's going to happen to my family? Is it gonna kill me? Are they gonna take my breast off? You know, cut it off? So there's a lot of stigma related to what cancer is, what breast cancer is, the treatments available. That all that is fear. And so I think one of the good things that we do is that we just talk to women, just have conversations with them, try to answer as many questions as they have, follow up with the women. Sometimes, you know, we call our women back, especially the ones who maybe are under 40 that are not necessarily at age to start getting mammograms. We do call them back and say, hey, did you go to the health department and get a clinical breast exam? If you did, great. You know, how did it go? Do you have any other questions? If not, how can we help you? So I think the follow-up piece is the piece that really helps with our women, and just being able to talk to them.
Yes.
And
them to talk to you.
Exactly.
You know, and not just at the initial visit or one time or two. Sometimes, well, not only with cancer, but with any condition or diagnoses, sometimes you're just gripped in fear or the uncertainty for a while that you can't even think. You know, do you have questions? I can't even think straight. But maybe 2 weeks later or a month later, yes, you know, the questions begin to come. So you are there for them.
Yeah.
And you are one of the persons, and other health educators that are there for them with those questions.
If I might add, I had a very, very good support system personally when I was going through.
Yes.
And so I understand that some women don't have that. And I've known of women whose husbands have left once they were diagnosed with breast cancer.
Wow. Yes.
Or if they lost a breast. But I didn't have that experience, so I'm there hopefully as a support for some of those women to let them know that life goes on. And I went through all of those stages. I mean, I had chemotherapy. I lost all of my hair. I can talk to somebody about that.
Yes.
I had radiation, you know, 32 treatments, whatever. I had a bilateral mastectomy. And so, and I'm living and I'm happy and I can just go on. And women need to see that, and we need to put it out there so that they know.
That is awesome.
Yeah.
I'm living, I'm happy.
I'm living, I'm happy.
And I would add, and you're beautiful.
Thank you.
Yes, still beautiful. And that's what women need to hear and they need to see.
Yes.
So I'm just so excited about you being on Can We Talk at this juncture so that we can get the word out to women. Who are some of the partners in the community that you work with? And I'm really wanting to head toward faith-based connectivity and any networking that we need to forge for the success of this initiative.
Carla has done a lot of community education sessions in local churches. And we have another breast health educator. Her name is Susie Warren. She's Latina. She's also a breast cancer survivor. And she's done a lot of community education sessions with the Latino-based churches. And so that's been a great connection because between Carla and we have we have several breast health educators. Another breast health educator, her name is Erica Perez. She's Pastor Moses Perez's wife.
Oh, okay. Yes.
She's one of our breast health educators.
Yes.
Yeah, so his wife is a breast health educator. Okay. And so what we did initially was really sit down and think about, be strategic about who we educated as a breast health educator in our community. And we really wanted, and I say we because my partner at ECU is Dr. Alice Richmond, and so we both sat down and we thought through, okay, what would be the most effective way to really get the word out? And obviously working with our community is the best way. And so we reached out to women that could really help us target the segment of the population that does not usually go for mammograms, the uninsured, the underinsured, and those women that maybe aren't really involved in preventive care for themselves.
Yes.
Most women do a lot of preventive care for their families, right? Their children. They take kids to get vaccinated if they are sick, but they never take care of themselves. And so we thought, well, let's be very strategic and get women that are survivors that can talk about the importance of screening. And look at me, I survived, I'm doing great. And it's been very helpful. And also community partners like yourself, Pastor Coles, who allow us to kind of reach out to a broader audience. And we do a lot of work also with other community outreach workers in the Bernstein Clinic, those kind of people. They refer a lot of women to our initiative to get screened. Those that don't get educated via our education sessions in the community will get the education at the screening clinics. So great, you got connected to come get a mammogram. We're not going to let you leave until you understand the importance of why you're here, so that you can continue to get one every other year after. So we do our best to really try to increase that education and awareness level.
So in addition to persons having the opportunity via making appointments or whatever, when they hear of this great service to come in, you also go out into the community.
We do.
So Carla and other health educators, wellness educators, you're open to invitations from churches and other faith-based organizations to come and present to a women's fellowship at a local church or other places and times?
Yes, certainly.
Definitely.
Wonderful.
And I've been I've been able to attend a service, and there were men there as well in the congregation.
Of course.
And they sat and listened and to take that information home or to, somebody else that may not have been there that day.
If their spouse, their wife was not there, their mothers, their daughters, their sisters.
Or they may need to hear for themselves.
Absolutely, absolutely. This is so valuable. And this it sounds like a movement that has been going on across the nation.
Yes.
Breast cancer awareness and fundraising for breast cancer research and all of that. Well, it is exciting to know that Pitt County and other surrounding counties in eastern North Carolina have really taken this by the horn and are doing some things very constructively and very decisively with it. How can persons get to you if someone is listening to this program today and they say, well, I'm not sure, maybe they haven't even gone to a doctor, a local physician, because not everyone have a primary care physician.
No, not everyone has one.
To go in maybe even just once a year for a health check, a wellness check or not. So what would you advise them to do?
They can call me directly at my office. I'm always available and able to help women. I've had women call me all the time, whether it's, Latina women, African, any woman that needs help can just give me a call and I'll be happy to do an assessment right on the spot if I'm in my office. If not, I definitely call them back and we do our best to listen to what they need and then navigate them to what the service that they need, whether it's a clinical breast exam, whether it's a mammogram, whether it's maybe applying for the breast and cervical cancer program that the health department has. We have those applications available. We can help women fill them out, and we work with the health department so that we can just send them directly to them and they can get processed in a efficient and quick manner. So my phone number, it's 252-328-1818. Feel free to give me a call. I always check my phone, and I'm very good at getting back to women, especially women in our community. They're my top priority when I get that phone call.
Absolutely, absolutely. Most counties have, of course, have county health departments.
Yes.
So if they didn't catch that number or forget it or didn't get the opportunity to jot it down, can they call the health department, which is a general public number, and try to connect with you? Would they have your number that they could give them?
The health department has a number for the initiative.
Yes.
Which is a general number.
Okay.
The number I gave them is my personal number in my office. So they can just give me a call, and it might be a little quicker than calling the health department.
Oh, gosh, we appreciate your availability.
Of course.
That is wonderful.
That is what we're here for.
Wonderful. How can faith-based organizations and institutions, i.e. churches and synagogues and so forth, how can we be of help and connect and partner with you in a sense to enlarge our reach? And I'm sure that's what the initiative is wanting to do.
Yes, well, that's
you don't
actually
have a limit. You don't have a limited number. Like we can only serve 25 people.
No,
wonderful.
The more the better.
Yes.
Education, it could be for anyone. And actually, the next iteration, I guess, of the education component is really thinking about how can we kind of expand our educational program so that it reaches more women. And I think what we were thinking about, and remember, I don't know if you remember, we discussed it at the last pastors' meeting that we had, was to really see if there is interest in some of the churches to have some of their membership trained as breast health educators. And that would be really the next step, because then it stops being a program from ECU and it transitions into a community program. See what I'm saying?
Yes.
So we build that capacity, and then that capacity is yours.
Wonderful,
Whether we are here or not, it will continue. And that's really the goal of a lot of the work I do.
And particular congregations can readily have someone right there.
Exactly.
Right there at all times.
Exactly.
Because we are members one of another in the body of Christ. So they can access knowledge and information and referral. If we need to get someone to you guys.
Exactly.
Because you're so well trained and established in the initiative and the various components, the education, the training, and so forth. But it would just be strategic if someone within congregations or other organizations are trained themselves.
Exactly.
Wonderful.
And then you would always have our team as more of a support, to get you materials, to help you with maybe events or some of the logistical aspects of running this that really, is more of a headache than anything. But, you would have us as your support team. And so that's really what we're thinking might be the next step for this initiative, for the education part of the initiative.
Now, for those counties you named that you are working with, this initiative is available in Edgecombe and Wilson counties, in addition to, of course, Pitt County, which is the base program. What about other counties in eastern North Carolina? Beaufort County, Carteret County, Craven. Are you aware of any programs that those counties may have similar to this? Or
Yes. I know that the Susan G. Komen affiliate, which is Triangle to the Coast, it covers 27 counties in East North Carolina. And I know that they have a lot of funded programs in different counties. Some focus on education, some focus on screening, some focus more so after a woman is diagnosed and helping that woman kind of navigate those waters, again, because of all the shock and emotion that comes with a breast cancer diagnosis. And so it really just depends on what your county is, and usually it involves your local breast health mammography place or the health
Okay.
department,
Yes.
or your local hospital. So I'm saying for the most part, those are usually the partners for these kinds of initiatives.
Wonderful.
So if anything, you could probably call the health department or your local hospital and ask if that is something that they have.
With breast cancer and all other cancers and many other diseases or conditions, the word is early detection is better,
Yes.
right?
Definitely.
I am just so impressed with this initiative being termed breast wellness initiative, not breast
Breast cancer.
cancer
Right.
initiative. What would you advise women to do who, don't have a diagnosis, but what can we do as women in terms of just monitoring our health in general, so that if a cancer were to appear, because we are doing our monitoring in whatever fashion, either self exams or going to our physician, at a prescribed period of time each year. What else would you say that we need to do just so that we can promote wellness?
You want to do whatever you can to remain healthy, and that would be, and you can adopt those healthy habits at any point, and that would be watching your weight, not smoking,
Limited alcohol consumption.
consumption.
Yeah.
Getting your preventive screening, so whether it's for
Yes.
breast cancer or cervical cancer, getting your pap smears, getting your mammograms or clinical breast exams. There's a lot of cancers have screening exams, like prostate cancer for men,
Yes.
right? You want to
Yes.
get those. I know it's not an exam that's favorable among our population, but it's very necessary. And I think with a lot of these screening exams, there's a fear that it's going to hurt, that it's going to be uncomfortable.
Yes.
Even with a mammogram.
Yes.
Even with a mammogram, a lot of women are
Yes.
very petrified. They're scared because they've heard these horror stories about the mammography, machine. And I think
Yes.
what we have to remember is that it doesn't hurt. It is somewhat uncomfortable, but it's 20 minutes that can save your life.
Yes.
And so
that's the key. Yes.
and that's the key with any cancer screening exam. Yes, it might be uncomfortable, but it's a short discomfort and it can save your life.
Wow.
And so I think if we just remember that, in addition to living a healthy lifestyle, nutrition, exercise, also if women are in the childbearing age, breastfeeding is very helpful. It serves as a protective factor for breast cancer, especially among African American women.
Wow.
So
Okay.
if you can breastfeed, it's a benefit for the mom and obviously for the child as well.
Sure.
So just adapting those kind of behaviors can help reduce your
And
risk
reducing stress
and reducing stress. Yeah.
in your life.
One final question. At what age should a woman begin to have a mammogram?
It's a great
And I know
question.
that varies. Almost every 2 years we come out with a different age.
We're at 40 now.
Yes.
But what are we sort of going
For
with
this
now?
program, we are promoting 40 and older.
Okay.
So if you are 40 years or older, you should get a mammogram and a clinical breast exam every year.
Every year.
If you are in your 20s and 30s, you should get a clinical breast exam about every 3 years.
Wonderful.
Unless you feel like you might be at high risk because of either your family health history or if you found some kind of symptom or something that's abnormal for you, then you should definitely go and see your healthcare provider
Absolutely.
sooner than 3 years.
Thank you so much,
Thank
Dr.
you
Essie
very-
Torres.
thank you very much,
Assistant
Pastor
Professor
Roger.
with the Department of Health and Human Performance at East Carolina University. Also, Mrs. Carla Lee, a breast health educator with the Pitt County Breast Wellness Initiative. I'm going to highlight that word wellness because it is the will of God that we prosper and be in health, even as our
Amen.
souls
Yes.
prosper. Thank you so much for joining us.
Thank you.
Again, this is Pastor Eve Rogers, your host on Can We Talk. We look forward to seeing and sharing with you on another program of Can We Talk. Be blessed.